enter the patient's room, I'm going to check the patient's chart for any history of aspirations, anticoagulant therapies, any chronic sinus infections, any nasal polyps, any nosebleeds, and any facial, nasal, and oral surgeries. Okay, so I'm gonna walk in, close the curtain for privacy, perform hand hygiene, put all my supplies on a clean surface. Hi, Mr. Smith, my name is Milana. I'm going to be your student nurse today. May I please just verify your name and date of birth against the wristband? Everything looks good. According to the doctor's orders, I'm just here to place an NG tube to make sure you get the proper nutrients to be able to perform feeding for you. Once we realize that you're able to properly feed on your own, we will remove the NG tube. Just want to let you know that during the procedure, you may feel some nasal discomfort and some gagging. Do you have any questions for me? No? Okay, thank you. Do I have your consent to do this? Yes, okay. But before we begin, I do have a few questions for you, if that's okay. Are you in any pain right now? No? Okay. Any nausea or vomiting? No. Okay, and just have you had any recent nosebleeds? No? Okay. Any recent nasal trauma or injury? No? Okay. So now I'm just gonna raise the bed to high Fowler's. Gonna put Mr. Smith in high Fowler's position. Raise the bed to hip level. It's more comfortable. Put down the side rail. Okay, perform hand hygiene. Put on clean gloves. Okay. I'm just going to check the patient for bilateral patency. Please just breathe in and breathe out. Breathe in and breathe out. Perfect. Gonna take the tongue depressor. Say ah. Great. Gag reflex is intact. It's present. And I'm going to auscultate. I'm gonna auscultate the lung sounds. Okay. Okay. All right. Then I'm going to auscultate the bowel sounds. Lower. Lower. Great. No adjacent sounds heard. Okay. Then I'm going to prepare 4 pieces of tape. Okay, one with a split in the middle. Okay, before I begin, I just need to inspect. Okay. So I'm going to inspect the patient's nasal pathway. There seems to be no nasal polyps, no obstruction, no irritations, and no deviated septum. Okay. Next, take out the tube. I'm going to measure from the tip of the nose to the ear to the xiphoid process, which is at the bottom of the sternum. I'm going to place a piece of tape there to mark to where I need to go. Okay. I'm going to attach the syringe. Okay. And then lubricate tube up to 4 inches. Okay. I'll replace this in case there's any gagging or vomiting. Mr. Smith, if you can please just take a sip and swallow each time I insert the tube. And before I begin, I just want to set some communication with you. If you're feeling any discomfort, if you can please just raise your left hand, and if you feel that a lot of pain that you need me to stop, please just raise both hands. Okay, going to place Mr. Smith's chin to his chest. Gonna go back and down. Oh my God. Back and down. Just swallow. Back and down. Back and down. Swallow. Perfect. Going to hold it. Place this piece of tape. And then wrap it around. Okay, wrap it this way. Another piece of tape on top. Okay. Then I'm going to remove the content, about 10 milliliters, from the syringe. Okay, I'm going to place it in here. If I took too much, I'm gonna put back the gastric content. Next, I would take a litmus paper to check for acidity. It should be around like 4 or 5, would probably be an orange color. If this was done for feeding, I would send the patient for an x-ray to make sure tube placement was proper. I'm also going to check. Tube seems to be not coiled, properly placed. Going to then cap the connector. Take the last piece of tape, connect it to the patient's gown. Okay. Discard this. Discard of my gloves. I'm going to auscultate the patient's lung sounds again. Okay. Okay. All right, so now this would be the next day. I would come in, perform hand hygiene, put on clean gloves. Hi, Mr. Smith. So we noticed that you're able to properly feed now, and we're just going to remove the NG tube. Is that okay? You may feel a little bit of discomfort. If you can, just hold your breath while I'm going to remove the tube. Okay. Okay, going to remove the tape. Okay, just hold your breath, please. All right. Okay, so the tube is intact. Everything seems okay. I'll discard of this. I'll remove my gloves. Perform hand hygiene. Raise the rail. Down. Okay. Okay, I'll make sure the bed is locked. Give the call light. How are you feeling, Mr. Smith? Any pain? Are you comfortable? Do you need anything else? No? Okay, thank you. Perform hand hygiene and leave.